I'm talking today to Bill Miller. Bill is Emeritus Distinguished Professor of Psychology and Psychiatry at the University of New Mexico, where he is also affiliated with the Center for Alcohol, Substance Abuse and Addiction. And we're speaking by Zoom, and it's the 11th of March, 2021. Now, Bill is known across the world for introducing motivational interviewing to the addiction field and continuing to inspire people in countries, both English speaking and not primarily English speaking, to practice and research motivational interviewing. And this is what he's going to be hopefully talking to us some more about. People, a lot of you will have seen the interview that I did with Bill back in New Mexico in 1993, where he talked to us about motivational interviewing and the developments over then the past 10 years since the paper that was published in 1983. And I remember so well a colleague coming into my office that year and saying, have you seen this paper? Motivational interviewing with problem drinkers. And that's where the whole thing began for me and for so many people. I still get my students to read that paper. It contains all of the basic tenets of motivational interviewing, the theoretical basis, Bill's experience of practice. So Bill, what I would like to do is to ask you to tell us about the developments, because as I say, this has stood the test of time, and there has been such a lot of research on the effective components of motivational interviewing, on its effectiveness generally. Tell us what the main developments have been from your perspective, both led by you and by other people since that time, if you would.
You forgot to mention that we're old friends too, so I think that's worth mentioning. Yeah. So what you're interested in what's happened since the last time we talked in '93? Oh my word. Oh my word. Who knew?
Who knew?
Yeah, exactly. A couple of editions of the main text since then, our second and third edition. Each quite different, and yet the heart of it is still there. I'm heartened in listening to that '93 interview, how the heart of this has held up over time. We understand it more deeply, I think, and we know how to teach it better. And yet the basic method is still what we described in that room in Norway in the 1980s, and that's very encouraging. Well, I mean, this has spread obviously beyond addiction, which was the first thing that we noticed with the second edition. The book was no longer about addiction, it was about change in general. Moved into healthcare and then many other fields that I never anticipated. Spread around the world with virtually no marketing, which is interesting. We know of 58 languages where this is being taught and practiced now, which is astonishing to me. Lots and lots of research. I keep a running log of controlled trials that have involved motivational interviewing, and we've crossed 1,500 at this point worldwide. So there's just something about this that seems to spread. It's like we found something about human nature that people recognize in very different cultures. There's something about this that is the same, even though, of course, the way you do it differs from culture to culture. But I think there's something basic fundamentally about human nature in motivational interviewing. Lots of trainers around the world now. I mean, the Motivational Interviewing Network of Trainers has happened since that last interview we had, and has grown dramatically. So that's intriguing. We know a lot more about change talk. Even at the time of the second edition, we hadn't quite formulated that as well as we have now, with help from a psycholinguist named Paul Amrine. So the darn cats model of just a way of thinking about different kinds of change talk emerged since that last conversation. So it's just, it's grown and grown. And people say, where do you think this is going? And my answer always is, I have no idea. At the time of the first edition, we couldn't envision the second or what would be in it, and the same from the second to the third edition. And now Steve and I are starting to talk about a fourth edition somewhere down the line, probably in a couple of years. So it's organic. And rather than feeling like this is something I created, I feel more like it's a wave I'm trying to stay on the surfboard and
yes,
keep up with this amazing momentum. So that's at least a quick overview.
It is, and there are some things that you've said there that I'm going to pick up and ask you to elaborate on. And the first obvious thing is, what is that thing you're talking about that has carried it, that has, like, when you talk about it spread without any marketing, that was the thousands of repetitions of that person coming into my office and saying, look at this paper, have you seen this paper? Mm-hmm. What is that thing? What is that thing? I have my view. What's your view? What is that thing that you have you've spread the word about, really?
Well, I can only speculate. I just finished a book on ambivalence as a universal human experience.
Yes.
And that certainly lies at the heart of this, thanks to Steve Rolnick. I mean, he really helped me to get clear that part of what we were talking about is this natural human experience of being torn in two different directions at the same time. So whatever culture you live in, you seem to recognize that experience of, oh yes, maybe every day we experience that. So that's a piece of it. I think it's also fairly universal that people don't particularly appreciate being told what to do and being told what's wrong with them. And that the natural reaction to that is pushback. Psychological reactance is a well-established phenomenon that when you're given advice, particularly uninvited advice, the most likely thing you will do is either nothing or the opposite. Even if you agree with the advice, which is fascinating. And I read an evolutionary psychology explanation of what that may be about, but I think it's somewhere in there, in that experience of just naturally in your life feeling pulled in different directions and disliking someone telling you which direction to go when you're in that situation. So a hunger to be heard and understood, but not to be pushed and directed. I think somewhere in there is what seems to be recognized across cultures.
And let me pick up on that as well, that you're saying, on the cultural relevance across different cultures. What can you tell us about, you said something about how maybe people do it slightly differently in different cultures. Give us a sense of the cultural diversity that you have found, different people practicing in different ways. Give us a sense of the range of that cultural diversity. We're familiar kind of with our own cultures. Tell me about different cultural contexts in which you found people have made this work.
The one I'm most familiar with, other than my own, is Native American culture.
Okay.
New Mexico has many tribes who have been here for a long time, longer than the Europeans have. And the culture of time and the way you talk to each other is quite different in most tribal contexts. To go in and tell someone what's wrong with them and what they should do is psychopathic behavior in a Native American context. It's just something that you would not do. And what my Native American colleagues tell me is this is much more like the way we talk with each other, the way we listen to each other also. So it seems to fit well into indigenous cultures here. And it looks like indigenous cultures in many places. It's quite different from domination. It's quite different from telling people what to do. And that seems to be welcome. And indeed, there's interesting evidence emerging that MI seems to work more, better, larger effect size with people from disadvantaged backgrounds, from what we might call minorities in the United States. So the effect size is significantly larger when you're working with people who are very different from yourself than when you're working with people from a majority culture and you're very familiar. Now, I have taught this in many different countries, but I don't know how to do motivational interviewing in Korea. I don't know how to do motivational interviewing in Africa. But the people who live there will know how to do it.
Yeah.
So it's a matter of conveying what seems to be the essence of it, or what we've learned so far, and then people figuring out, how do you do that in this cultural context? And it's not that I know that and prescribe that. It's conveying what seems to be universal about this, and then you figure out how it is that that's done well in your own culture. Even American and British culture, some differences that I've learned over the years, one of which has to do with the American overuse of affirmation. And in Britain, that can be perceived or at least suspected to be kind of vaguely critical or saying something nasty about the person, but doing it subtly, you know. So I have picked that up in the times that I've had to be in Britain. And that's just a small example compared to other cultural differences with Asian, African, and indigenous cultures. But I think this is best done by people from the culture because they know and grew up in and understand that culture.
And I think that's it's so interesting, the point you're making here, because some of what you're saying sounds possibly, when you first introduced the idea of motivational interviewing in that early paper, we live in a culture, both in the United States and in the UK and in many European and other countries, where we have this idea about the importance of self-determination. Mm-hmm. And yet and you describe this in the paper, we had a treatment culture across the board, not just in the addiction, but particularly in the addiction, of telling people what to do. That's what used to happen. So in a way, what you're describing is so interesting, because other cultures different to this are perfectly capable of knowing this is an absolute contradiction. And yet for years, we seemed in our culture incapable of seeing that this is a contradiction. You have a culture of self-determination, and then somebody does something that they shouldn't be doing, and you come in and you tell them to stop it and try and tell them. And this is why motivational interviewing was such a liberating, both made sense and was so liberating.
Well, what culture is more individualistic and insisting on autonomy than American culture? I mean, and yet we did the same thing.
Yeah.
Just had this sort of idea that the way you get people to change is you make them feel bad enough. You shame them and humiliate them and tell them what reality is and give them clear directions. And that's supposed to help them. I mean, it never did. There never was any good science behind that. And yet it's still easy to find in many forms of practice here.
Yes. And I want to come back to a point that you've made and about people who practice it well. And you've spent many years teaching people, and as have I, and there are people who do it, motivational interviewing, much better than other people. And you've always said, yes, it can be taught. It can't be taught to everybody. It can be taught. What are the characteristics of people who do it really well?
I wish I knew. I mean, when I've had to select people to be motivational interviewers, I have preferred to select people who were already good at Carl Rogers, who are already good at listening, who already had that skill of accurate empathy, at least reasonably. Because that's harder to teach. It takes longer to get people from a place where they're seeing things within their own framework to looking through the eyes of the person that they're talking to. So people who have that kind of empathy, and I'm talking about a skill, not a personality characteristic, who have that skillfulness in being able to listen and take the perspective of another person, can more easily learn motivational interviewing. But I don't think you have to already be good at that. I mean, if there's time, as there is in clinical training, to help shape that, you can start with people even further back. For 30 years, I taught first accurate empathy and then motivational interviewing as the first course in our doctoral program in clinical psychology. So I taught these kinds of skills to a lot of people. And there were only a handful over 30 years that I felt like I wasn't successful in helping them develop some skill in accurate empathy. And it seemed to me that these were folks who just had difficulty taking any other perspective than their own, even recognizing the existence of perspectives other than their own. And it wasn't very many. Now, these people coming to a clinical psychology program, so a select example perhaps. But I think most people can develop skills in this. And indeed, with a handful of people, it's simply that I didn't know how to teach them. I wasn't successful in teaching them. And there may be better ways to help them to do this too. But I think empathy is just a natural, evolved human skill. And it's basically what's going on here. I have said 80% of what we do is Carl Rogers. And that's still true. Rogers was brilliant and way ahead of his time. And a consummate scientist also. Yes. I mean, he really brought psychology, clinical psychology, into the scientific realm. And I think people have forgotten that often at this point, but he was very insistent that your beliefs are hypotheses to be tested, and other people should be able to test them and find the same things that you do. So using a scientific method to develop better therapists.
Yes. Great. And if we could then move on to the question about the recipients of motivational interviewing and what you have found. And there's been a lot of research, and we were both involved in different trials looking to try and match people who did better with one approach or another. What would you say to us in 2021 about those people who are most likely to benefit, and if there are people least likely, groups of people, populations of what can you tell us about that?
Yeah. Well, first I would say humility. Coming out of Project Match, I think there were 21 hypotheses altogether, many of which had to do with who would respond and not respond to motivational interview, and almost all of them were wrong. And they were perfectly good guesses based on the literature. So I'm not sure we're particularly good at knowing what's best for people we're working with. But a few things seem to have held up. People who seem less motivated for change initially seem to respond better to this approach than to a directive approach telling them what to do. So that's very consistent with where the approach began. People who are angry or resistant, whatever that means, you're better off taking this kind of person-centered approach, an evocative approach, than a directive authoritarian approach. And that's pretty clear. We haven't found a diagnosis yet that doesn't respond to motivational interviewing, and there have been lots of proposals. We assumed in Match that people who were sociopathic wouldn't respond to motivational enhancement because those people don't form relationships. Well, wrong. It was unrelated to outcomes of motivational interviewing. We thought maybe psychosis, schizophrenia, that a person with a thought disorder couldn't respond to this. Well, that's clearly not so. There's probably a developmental level in children and in adults for that matter, because what we're essentially doing is trying to kick in self-regulation, trying to help people reflect on where they are and have their own thermostat begin to say, okay, it's time for a change. And there's probably a developmental level. We're pretty sure that this works well with teenagers who were 16, 17, 18. We're much less sure about younger kids. But I guess the saving grace there is with younger children, you should be talking to the parents anyhow, because the parents are the frontal lobes for the kids. So, but we know less about doing this with younger children. And people who are already ready for change don't really need the evocative piece of motivational interviewing, at least. One thing that was found in several studies was that motivational interviewing seemed to deter people who had a higher level of readiness for change. Now, I think with our 4-process model, that's just a matter of using the wrong process. Right. If someone comes in and says, I want to stop smoking, tell me what to do, I'm ready to go. You don't want to do a lot of reflective listening and asking them the good things and less good things about smoking, and they're ready to go. So planning is the place to be working. And if you've got there too soon, you'll find out quickly. But it's so much of motivational interviewing is about paying close attention to what the person is telling you in the moment and responding to that and changing what you're doing, which is also how you learn motivational interviewing. Changing what you're doing based on the feedback that you're getting from your clients. So those are the things really. I mean, there aren't big contraindications other than don't spend a lot of time evoking when the person's already ready for change. It's follow their lead and go with them. And then the sensible indicators that if the person seems gruff or more reluctant to be there and doesn't want to change, looks like a pretty good place to start. But I got to say that I'm more and more thinking of motivational interviewing not as a separate therapy, but as a way of doing what else you do. So it's a way of doing cognitive behavior therapy. It's a way of doing diabetes education. It's a way of being a probation officer. So it doesn't make sense to me now to have horse race trials like we did in Project Match, comparing motivational interviewing against cognitive behavior therapy, because they go together so easily. And they always have for me, because I learned Rogers first. Um, and so the book that Terry Moyers and I just released is about what is it about therapists? Because whatever the theoretical orientation, whatever the manual you're using, clients' outcomes differ substantially based on who delivered the treatment. And what is it about those people? And it was motivational interviewing that pointed me toward asking that question, because I think in a way what we've been doing all these years is studying what makes more effective helpers. What is it about the person that contributes to outcomes? Um, and, and that feels right to me. This is not a different theory of psychotherapy. This is a way of doing psychotherapy and healthcare and probation and social work and all sorts of things.
And there's such a lot of evidence to back up what you're saying here. Some people, I think, have the feeling that it's very complicated and there are lots of strategies and there are lots of different skills and different ways of saying things involved in motivational interviewing. And when you talk about it, you're making it sound, I don't want to say simple, simple doesn't sound right, but you're kind of simplifying some of that. Such a lot has been written about, you know, about reflections and about, you know, and there is such a lot for people sometimes feel to get their heads around. And yet your message here is very clear and very simple. What are those key things that you and Terry Moyers were focusing on, that it's about what people do across the board, in spite of a particular intervention protocol or something like that? What are those key things?
Yeah, they're not surprising. We have 8 of them in that book, and the one with the strongest evidence is accurate empathy. Just listening well and stepping inside the framework of your client is something that improves outcomes in all sorts of endeavors. I think including education and sports. Steve just wrote a book on athletics, where this seems to be the case too. So that one stood out just scientifically above the rest. But you know, acceptance and unconditional positive regard, what Rogers was talking about, which in motivational interviewing we talk about in affirmation kinds of terms. Genuineness, being yourself rather than putting on a mask and taking on a different role when you become a helper. Having structure, I mean, having a clear focus, which is the word we use in MI, and a plan for getting there, and sticking to the plan rather than talking about whatever happens to come up in a particular session. That's one of them. So it's not rocket science. Everything that we have included, with one exception, you usually see in lists of non-specific factors. The one that we added, interestingly, is evocation, which we definitely learned from motivational interviewing. And that's arranging your conversation in a way that it invites your clients to say particular kinds of things. In motivational interviewing, it's change talk. In client-centered therapy, it's called experiencing. It's kind of talking at a deeper rather than superficial level. And you can tie those things that you hear in session to better client outcomes down the line. So strategically doing things to influence what clients are saying during session. Now, we knew already that from listening to what clients say, we can kind of get a sense of whether change is going to happen or not. But I think before Jenlen's work on experiencing and then motivational interviewing with change talk, we hadn't thought a great deal about how, as a therapist, you strategically evoke the kinds of responses from clients that actually do move in the direction of change. So I think that is a significant addition to the list of so-called non-specific or general therapeutic factors.
So I'm really hoping that everybody is going to have a look at that, because what you're saying is so important for practitioners, and so important for people to feel that they're making a difference. The addiction field is a difficult field to work in, and I think that what you're saying is very inspiring for practitioners, and particularly because you are addressing those points in people's change process that are the biggest challenge for people working in the addiction field. So thank you, Bill. You looked as if you were going to add another comment there.
Yeah, well, that's the positive side of this. I mean, these aren't personality attributes. These are skills that you can develop and practice over time that make a real difference in client outcomes. I mean, I dare say some therapists find this very threatening, because now we're talking about me. We're not talking about therapist manuals. We're talking about the way I am. And there's a reason why there hasn't been so much research looking at differences among therapists and what accounts for those, because it is kind of a little more scary topic. But what comes out of it that's positive is 8 things you can practice and 8 kinds of skills you can develop. That whatever your theoretical orientation or whatever your profession, if you can manifest these, you're likely to have better outcomes with your clients.
Bill, thank you very much. That's a very optimistic and positive note to end on. Very many thanks for sharing your thoughts and for enabling us to get this out to practitioners to be inspired by what you've done over the years and what you're saying now. Many thanks.
You're most welcome. Thanks for asking.